Vitamin B12 and autism. Vitamin B12 plays very important role in normal human being for their mental health, neurological health, and nerve health. Deficiency of vitamin B12 can cause memory problems, including dementia, and it can also affect the nerves, which can cause numbness, tingling, which quite often we do see in our neurology practice. Vitamin B12 and autism. We do see quite often that sometime when there is a deficiency of vitamin B12 in autistic kiddos, and when we replace this vitamin B12, their cognition, behaviors, their aggression, their mood, social, and sometimes speech skills gets better. What I always recommend is make sure you check the level of vitamin B12, because sometimes I have seen side effects of vitamin B12, like sometimes they become irritable, restlessness, their behavior gets worse, sometimes they are agitated, and sometimes facial flushing and rash can also happen with vitamin B12. Another common thing is vitamin B12 and leucovorin combination. Sometimes they use leucovorin and vitamin B12 together, which is off-label, not approved by the FDA, and some have noticed some improvement in speech, social skills, cognition, and behavior. What I always tell to all my patients is, if something works for my kid, it does not mean it's going to work for your kid also. Always talk to your doctor, always discuss the risks and the benefits and what you are trying to achieve, and then decide what is good for your kid. Please feel free to ask any questions. Thanks. Have a good day.